necessary.
The president's quarantine proposal met with an uproar.
It would just be anti-American, anti-social.
What he is doing instead, the strong travel advisory for millions of Americans as states take their own strict measures. Door-to-door searches to root out New Yorkers fleeing the hot zone and checkpoints in Florida. Cities like New Orleans predicting an explosion in cases. Their plea to the president.
Growing shortages of masks, gloves, and other protective equipment, leading some nurses to quit.
The current hospital that I was working at kept taking PPE away from us, and it was scaring us.
The intense pressure for these frontline workers forced to isolate themselves from loved ones, and the devastating news for this family.
New hope, the experimental treatment doctors are working on, now gaining attention. Antibodies from recovered patients. Will it be the answer to treating COVID-19?
Insta strike. Employees for delivery service Instacart preparing for a massive strike. Their list of demands this morning, including hazard pay.
And tornado outbreak.
Oh my God.
Twisters tearing through parts of the Midwest and South. Homes and businesses destroyed. Our weather team tracking more severe weather expected today.
Live from ABC News in New York, this is Good Morning America.
And good morning, everybody. Thanks so much for joining us on this Sunday morning. Let's get right to the latest developments in the coronavirus pandemic. Overnight, an abrupt reversal from President Trump, who briefly floated the idea of imposing a quarantine on New York, New Jersey, and Connecticut.
That notion was met with a swift pushback from the governors of those states, after which the president said he would instead issue a travel advisory.
Also overnight, a significant jump in the numbers here in New York City, where we now have more than 30,000 cases and almost 700 deaths. Nationally, we're at more than 120,000 cases and more than 2,000 deaths. We have team coverage this morning, and we start with ABC's Stephanie Ramos right here in Times Square. Stephanie, good morning to you.
Dan, good morning. The governors of New York, New Jersey, and Connecticut reacting strongly against the president's idea to quarantine the region, calling it an illegal lockdown. The CDC has now put in place travel warnings instead as COVID-19 cases in New York go up. This morning, New York City alone now has more than 30,000 confirmed cases of coronavirus and more than 200 deaths in just the last 24 hours. President Trump tweeting overnight that a federally enforced quarantine of the region will not be necessary and is instead having the CDC issue a strong travel advisory, urging New York area residents to not travel domestically for at least 14 days. The decision coming hours after New York's governor hit back at a quarantine proposal floated by the president, raising fears that the government would shut down major parts of the Northeast.
And if you start walling off areas all across the country, it would just be totally bizarre, counterproductive, anti-American, anti-social.
Trump has said governors from states less affected by the virus asked him to look into a quarantine for the tri-state area.
I don't believe it would be legal. I believe it would be illegal. I don't believe you can say you cannot leave the state of New York.
Some states implementing stricter measures to prevent the spread of COVID-19. Florida, South Carolina, Texas, Maryland, and Rhode Island ordering visitors from New York to self-quarantine for 14 days. The Sunshine State even setting up checkpoints on I-95 looking for New Yorkers. In Rhode Island, the National Guard scouring neighborhoods looking for cars with New York plates.
Folks from New York present a different kind of danger to the people of Rhode Island. I know this is unusual. I know it's extreme. And I know some people don't agree with it.
Governor Cuomo threatening to sue Rhode Island if they don't scale back the policy of tracking residents from the Empire State. New York, the epicenter of the crisis, is still in need of medical supplies. In the midst of travel warnings and social distancing, the president traveling to Virginia to send off the U.S. Navy hospital ship as it sails to New York City. But outside of New York, the pandemic hitting another grim milestone, claiming its youngest life yet in Illinois.
There has never before been a death associated with COVID-19 in an infant. If you haven't been paying attention, maybe this is your wake-up call.
Illinois preparing to become one of the nation's next hotspots. The governor there fearing they won't be able to shore up supplies while competing against other states and the government for orders.
But those who are at the bottom of the list may not see ventilators until, potentially months after they peak in terms of their COVID patients in their hospitals.
And a dire warning in Louisiana. COVID-19 cases spreading fast after Mardi Gras. 3,000 people infected. Hospitals full. The mayor of New Orleans saying she was not encouraged to cancel the festivities. Instead, administration officials publicly stated the virus was being contained.
We were hearing from the federal government that the virus was contained.
A Louisiana senator hoping one of the Navy's floating ships can be sent there too. In California, trails and beaches closed. Law enforcement taking to the sky to enforce restrictions. Governor Newsom saying the Golden State has received more ventilators from the national stockpile, but 170 of them are broken. But telling our Matt Gubman they'll be up and running soon.
They may not be working, but we're fixing them. So the fact is, we have the asset, we have the mindset, and we're going to solve a problem in 72 hours.
California's governor has also touted that the state has administered 90,000 COVID-19 tests, but they've only received test results for about 30,000. The governor says people are waiting 7 to 10 days for those results, and that's a sign of a possible surge in cases to come. Whit?
Yeah, the timing of those results continues to be an issue. Stephanie Ramos for us, thank you. Meantime, many states are projecting the peak of this pandemic is still weeks away, leaving President Trump with some big decisions to make over the country's next steps to slow the spread. ABC's Rachel Scott joins us from the White House with more. Rachel, good morning.
Whit, good morning. In the next 24 hours, the White House will be approaching the end of its 15-day initiative to slow the spread of the coronavirus. Officials have been encouraging Americans to practice social distancing, to work from home when possible. And now the president will have to decide whether or not he wants to loosen or tighten those guidelines. The president will be discussing how to move forward with his coronavirus task force team. But he has made clear he would like to see parts of the country that are not badly affected getting back to normal by Easter. Now, Vice President Mike Pence has said that goal is aspirational, but public officials have warned against that. They say moving too quickly would only cost more lives. More than 800,000 physicians from across the country sent a letter to the White House with a plea to keep that social distancing in place. Now, Pence says that they are reviewing the data by county and will be giving guidance to different regions of the country in the coming days. Dan?
Rachel, thank you. For more on all of this, let's bring in ABC's Martha Raddatz, who's also in D.C., where she'll be hosting This Week later this morning. Martha, good morning to you. So on this question of locking down versus opening up the economy, do we have a sense of where the president's head is at right now? First, we heard him say he wants to open up the country by Easter. Then overnight, he was floating the idea of a quarantine on the New York area. What's the direction here?
Well, I think, Dan, you hit the nail on the head when you say floated. I think in the last couple of days and in all this week, you've seen President Trump floating these ideas. Would it work to open things up by Easter? Would it work to have a complete lockdown in New York City, in Connecticut, and New Jersey? And I think he's clearly getting pushback on this. He clearly got pushback from Andrew Cuomo about basically locking down all of New York City. The president now says he's consulted with these governors, and there will be a travel advisory. So I think he is getting that feedback. He's also getting feedback from CDC officials and scientists about whether this is really feasible. But I think ultimately he does want to loosen some sort of restriction on parts of the country where it's not hitting hard. Certainly in New York and in California and Louisiana and places like that right now, they are overwhelmed in so many ways. But in the middle of the country, they are not feeling it as much. But the problem is, Dan, they weren't feeling it very hard a month and a half ago in these cities that are now in very, very bad shape. So that's a really hard decision.
It comes on quick. Let's talk politics here for a second. The president's poll numbers have been surging during the crisis. Overnight, We got some new numbers from an ABC News Washington Post poll. While Joe Biden still has a slim lead in the race against the incumbent, there is a huge enthusiasm gap. Only 24% of Biden's supporters enthusiastically support him. The president's at 53%. So how does Biden cut through in the midst of this national crisis?
I think it's very, very difficult. I think the enthusiasm gap for the election itself is not very large. Joe Biden has to walk that line of not being too critical of President Trump in a time of crisis in the country, but also trying to let people know he thinks he could do a better job. But it is very tricky, and I think this will play out over many, many months. The election is not till November.
Nope, and it is taking place under extraordinary circumstances, this campaign. Martha, thank you very much. I want to remind everybody, Martha has a big show this morning. She's going to interview the governors of New Jersey and Louisiana, both, as we've been reporting, hit hard by the coronavirus. She'll also go one-on-one with the president's chief economic advisor, Larry Kudlow. That's later this morning right here on ABC. And while I have you, in this busy, unprecedentedly busy news era, do not forget to tune into our new streaming service, ABC News Live. Eva, over to you.
Well, joining us now to answer more questions about COVID-19 from Newton, Massachusetts, is Dr. Todd Ellerin, an ABC News medical contributor and infectious diseases physician. Thank you so much for joining us. I guess let's get right to it. There was talk of a federal quarantine in the New York metro area, but there's also been talk of getting things back up and running by Easter. Where is the balance?
Okay, so remember, I think the message is the same. Social distancing is key. Staying at home is very important. So, whether we call it quarantine or not, some of that is semantics. Those are the key messages. As far as opening up the country right now or opening up New York, we are not there yet. Remember, in 2 weeks, we're going to have Easter. People who are infected right now may be displaying their symptoms then. So before we start to give a firm date of when we're going to start to open, we have to see how many infections there are, what does the epidemic curve look like. These are more important than the specific date.
We have now seen the first infant to die of COVID-19. What does this tell us, and should parents be concerned?
Yeah, so neonates are a vulnerable group. It's not the same as saying children, where we know children tolerate this virus much better. We have to do our best to protect this vulnerable population. And the way we do that is to protect mom and her partner from developing the infection. Again, social distancing, we keep coming back to that. Hand hygiene, staying away from mom if she's pregnant, if you're sick. These are very important. The other thing is, remember, during labor, if mom is infected, we have to follow the obstetric protocols, okay? The personal protective equipment for a mom of the baby as well as her partner. This is evolving and it's very important, but this is a vulnerable group, so we have to be careful.
Dr. Todd Ellerin, so good to have you this morning. Thank you so much for that insight, Whit.
All right, Eva, turning now to the medical workers in hospitals filling with patients trying to stretch their resources, some now taking to the streets, pleading for help. ABC's Trevor Ault is outside the new temporary hospital at the Javits Convention Center here in New York. Trevor, good morning to you.
Well, Whit, good morning. One survey says 90% of mayors nationwide say they don't have enough masks or tests, and those shortages are putting the strain directly on America's healthcare workers, who are already being pushed to the limit as they try to tackle this pandemic head on. This morning, as the count of coronavirus cases climbs higher, nurses leading multiple protests outside hospitals demanding access to more personal protective equipment. In New York, the father of a nurse desperate for his daughter's safety.
Have you asked your daughter not to keep going to work?
I have.
And what does she say?
She says she has to. She loves her job.
But for some, amid growing shortages of masks, gloves, and more, the risk has become too much. One nurse we spoke with, named Ashley, saying she didn't feel properly protected by her hospital, and despite loving the work, decided to quit.
The current hospital that I was working at kept taking PPE away from us and changing the guidelines, and it was scaring us. I felt that it was unsafe work conditions, so that's why I left.
Other nurses say guidelines from the CDC have allowed hospitals to scale back procedures for safety equipment that would have been required before the crisis. Meredith Johnson, a critical care nurse in South Carolina, says she feels unprotected.
We shouldn't be scared. This is our job. I did sign up for this, but I didn't sign up to do it without the right equipment. I didn't ever expect to be in a position where I would be sent to work and literally risking my life.
The risk of those on the front lines contracting the virus themselves has grown so great, many, like Arkansas Dr. Jared Burks, have moved out of their homes to protect their families. Dr. Burks captured in this now viral photo, getting as close as he can to his 1-year-old son.
It feels kind of crazy to be married to a doctor right now. There's a lot of uncertainty. And so while I'm proud of him and very, very thankful that he does what he does, there is this kind of fear of just what may come.
And this morning, we do have a pretty devastating update from that family in that viral photo. As if they weren't going through enough, the wife, Alyssa Burks, says yesterday they were in the path of an Arkansas tornado. And while the family is okay, they're safe, their house was destroyed. Dan?
I'm really glad they're okay, but that is terrible news. Trevor, thank you very much. And we should add that home was destroyed by one of at least 17 reported tornadoes in the central U.S. Rob is right here. He is, of course, tracking all of this. Good morning, sir.
Hi, good morning, Dan. Yeah, it was a rough 24 hours from Texas to Iowa to Pennsylvania. Over 190 damaging storm reports, including this tornado that ripped through Jonesboro with debris flying through the air around 5 p.m. Just a terrifying time for the people of Northeast Arkansas.
Good morning, Washington. Meteorologist
Hit. Terrified workers inside the cell phone and computer shop watch in fear as the twister causes transformers to explode and tosses debris into the air.
Oh my gosh, what are we even doing? This is a tornado on the ground, a big tornado. Oh my gosh!
Watch as this traffic camera captures the tornado moving just north of the interstate.
Oh, geez.
Tornado sirens blaring as the twister tears through the city. The aftermath looking like a war zone. The tornado leaving little behind but rubble in its path, crushing cars and ripping businesses to pieces. Fortunately, many had been closed because of the COVID-19 outbreak.
I hate to say this, but with the coronavirus, I think there was not as many people in that building, and it could have been much worse.
The tornado blamed for at least 6 injuries. Luckily, no deaths. Guy Riggins capturing the scene on video, the twister roaring by his apartment.
They say that it has a unique sound like a freight train, but in my experience, it was much louder. Definitely nothing like that I've ever heard.
Watching this play out on the radar and on television yesterday was terrifying for myself, but the point of the COVID actually being a benefit here, if this happened any other time, there likely would have been some fatalities. All right, this storm is not over. The squall line now cutting through Tennessee, back through parts of Alabama. We're getting flash flooding across parts of Ohio, Cleveland, I-90 problems there. And with snow still falling across parts of Minnesota, we have wind alerts. This is going to be a real big wind maker. If you're not getting severe weather, you'll see winds 40 to 50 miles an hour from Milwaukee to Chicago, back through Cleveland once that rain passes out, and then possibly some strong thunderstorms in Pennsylvania and the mid-Atlantic as this thing eventually pushes out to sea tomorrow. In replace of that, the next item up for bid is going to bring in some severe weather and likely some heavy rain into the areas that got hit by the tornado on Monday, and then the severe weather threat goes Tuesday across parts of the Florida Panhandle. So very active weather shaping up. That's check on the national weather headlines. Time now for a look at your local forecast.
Good morning, Washington. Meteorologist Alex Liggett here. We do have dense fog out there, mainly to the west of D.C. this morning. I think the clouds will begin to break by midday, noon to 1 o'clock. We will have the storm chance this afternoon between around 3 and 7. Could have some gusty winds with those highs today into the mid and upper 70s. As we look ahead to this next week, 69 on your Monday, breezy at times. Chance for showers. They will return to the region Tuesday evening. Better chance as we get into Wednesday.
Severe weather season, tornadoes in April, May, and June.
On top of everything else.
Yeah, the idea of social distancing when you're dealing with a tragedy is pretty difficult.
Yeah, but as you said, that some of this social distancing actually could be useful in that people are inside.
I think yesterday it did help.
Okay, thank you, Rob. Let's go over to Janae. She's been doing the right thing and staying home, given that she is pregnant, and she has a story this morning about some police officers who, like so many people these days, are going above and beyond the call of duty. Janae, good morning to you.
Hey guys, good morning. Yeah, we're trying to find the silver linings, those happy stories to bring a smile to your face. And this one comes from the Perry Township Police Department in Dublin, Ohio, where they're making sure their elderly residents don't have to feel alone while they're self-quarantining and social distancing. The police department there has set up a program where residents can sign up for a daily wellness check. So the Columbus Dispatch shared these pictures of an officer as he helped around